Hi, and welcome to Pearls, Procedural Education for Adaptation to Resource-Limited Settings, part of the Sugar curriculum. This is a demonstration video only. Be sure to watch the full instructional video for this skill at sugarprep.org. In this video, we'll review how to perform a lumbar puncture when we're not used to having the full supply kit we're used to. This session will be presented by Doctors Rachel Bensman, Alicia George, and Amy Rule on behalf of the Sugar investigators.
Here is a commercially available lumbar puncture tray, which you are probably accustomed to using to perform the procedure. However, these are rarely available in resource-limited settings, so let's talk about the supplies you'll definitely need. Essential supplies include gloves, sterile if possible, sterilizing supplies such as alcohol, spirits, and cotton wool, tape to create the bandage, a collecting tube which should be sterile and without additives, and a needle. If you have lidocaine, use that as well. The choice of needle is discussed in detail in the instructional video. Please view that prior to performing the procedure. Actually performing the lumbar puncture is relatively the same as you would do in a conventional setting. Find your landmarks, the top of the iliac crest, and move laterally to find the intervertebral space just above or below that point. Make sure your collecting tube and your needle are ready at your side. Go ahead and sterilize the skin, making sure to cover any area you may touch during the procedure, including along your landmarks in case the patient moves and you need to readjust. If you have lidocaine, go ahead and anesthetize the space soon. Often, however, it is unavailable in these settings. At this point, make sure your holder is prepared for patient movement. Find your landmarks again. Brace your needle in your hands against the patient's body and insert the needle in the intervertebral space aiming towards the umbilicus. At this point, it's important to note that although this patient probably won't fight too much, typically a patient who is having a lumbar puncture performed without any local anesthetic may have some reaction to the pain of inserting the needle. Make sure the holder has a good firm grip on the patient and that they are able to breathe comfortably. Once your needle has entered the subarachnoid space and fluid is exiting, grab your collecting tube and collect a few milliliters of fluid. You should have an idea of about how much your particular lab will need to run necessary studies. At this point, go ahead and withdraw your needle and grab some gauze and tape to cover the site. Make sure you always know where you set your needle. You may be performing this procedure in an atypical place, and you'll need to address picking up the needle immediately afterwards. Cap the needle safely either by allowing the cap to fall on the needle tip or scooping up the needle tip with the needle itself and securing it. Be sure to watch the complete instructional video of this skill at sugarprep.org. There you'll find links to other Sugar Pearls videos as well as access to the full Sugar curriculum.